Hi everyone, this is the specimen of liver. You know the human liver, it is situated in the right hypochondrium, in the region of the epigastrium and in the region of the left hypochondrium. So this is the weight of the adult liver is 1.5 kg, and this liver it spells about LIVER 5 words, and it has got the following mnemonics. That means it has got 5 borders, 5 surfaces, 5 bare areas, 5 fissure. All of you know. You see, now what are the surfaces you will see? The liver, it is a mixed gland. Why it is a mixed gland? Because it has got the endocrine function and it has got the exocrine function. The exocrine function is that is the formation of the bile, and that bile comes out through a duct. This is known as the hepatic duct, and this hepatic duct unite with the cystic duct. It goes into the gallbladder where there is concentration of the bile. Next you will see that this endocrine part, that means within the liver there is neoglucogenesis. That means the liver is our kitchen. There is the formation of the glucose from many food substances, and this is the endocrine part of the liver. Now the liver consists of a massive right lobe and thin left lobe, and these two lobes are separated anteriorly by means of a ligament, and this peritoneal ligament is known as falciform ligament. So the right side of this falciform ligament, this is the right lobe of the liver. Left side of the ligament, this is the left lobe of the liver. In case of this demarcation, this is the anatomical demarcation of the two lobes. That is, behind it is by the fissure for the ligamentum venosum. This is the fissure for the ligamentum venosum, and this is the fissure for the ligamentum teres. So right to this fissure, this is the right lobe and this is the left lobe. But physiologically the liver is very important. Now physiological left lobe of the liver passes through the cholecysto-venacaval line. Cholecysto means gallbladder, this is the gallbladder, and vena cava means this is the inferior vena cava. So this line, it demarcates to the right lobe and the left lobe. Here the left lobe includes this caudate lobe and this quadrate lobe. This is the quadrate lobe of the liver. That is, you will see here. So the physiological lobe includes the caudate and quadrate, but anatomical lobe, it includes the caudate and the quadrate lobe in the right lobe. Next you will see the surfaces of the liver. This is the anterior surface, triangular. It is shiny because of the peritoneum is attached to this. Next, this is the right lateral surface, which is related to 7th to 11th rib. This is the prominent inferior surface. It is related with the different organs. And this is the posterior surface, you will see, between the posterior superior border and the posterior inferior border. This posterior surface is more prominent in case of the right lobe of the liver. And then this is the superior surface, you will see, where there is bifurcation of the falciform ligament. This is the falciform ligament, so it is bifurcate in this region, and here you will see the opening of the two veins, and that is the hepatic vein here. How will you hold the liver in anatomical position? You will hold the liver in such a way that the inferior surface located inferiorly, inferior surface is identified by the presence of gallbladder and the fossa for the gallbladder. And you will see this is the anterior surface, and the looks of the inferior surface is downwards, backwards and towards the left. So this is the anatomical position of the liver. Next, what are the different bare areas of the liver? There are 5 bare areas, out of which you see this is the triangular bare area. This is bounded by the superior layer of the coronary ligament, behind by the inferior layer of the coronary ligament. Base is formed by the groove for the inferior vena cava. If I lift the inferior vena cava from the groove, groove becomes prominent. You will see the groove become prominent here. So this is the groove for the inferior vena cava, and this is the meeting of the two is the apex. Now this part is, you see the liver is actually connected with the diaphragm by this ligament. It is a huge organ, so it must be attached with the diaphragm by the ligament. This is the right triangular ligament and this is the left triangular ligament by which the liver is attached. And not only that, it is by the hepatic vein, it is also kept in position in the body. Next, you will see there are another bare area in the inferior surface. Now, in the inferior surface, this is the fossa for the gallbladder. This fossa for the gallbladder is the bare area. You see, this is the bare area. Another bare area you see where from the hepatic ducts, hepatic artery, these are coming out. So, this is another bare area. So, this is known as the porta hepatis. And the groove for the inferior vena cava is also another bare area. So these are the bare areas of the liver. You will see this is the caudate process, and on the left side of the caudate process you will see this is the fissure for the ligamentum venosum, and another fissure between the right lobe and the left lobe. This is the known as the ligamentum teres. Teres means you see the rounded ligament. Now this is the different surfaces of the liver. Now what is the arterial supply of the liver? By the hepatic artery, and the blood supply of the liver is by the portal vein. 20% supply is by hepatic artery and 80% is supplied by the portal vein. So when there is the disease of the liver, particularly the cirrhosis of the liver, there is the liver is shrink, the liver tissue is lost, and this is replaced by fibrous tissue. So there is portal hypertension. So this is the liver in anatomical position, and say the viscera during your oral examination by holding the viscera in anatomical position. Now the inferior surface of the liver is related with a very important organ and the huge organ. This is the stomach. You see how the stomach is related with the liver and comes out from the inferior border. So you see this is the position of the stomach, the impression of the stomach with the left lobe of the liver. Thank you everyone.